2023 Medicare updates. Hi, my name is Robert Bache, MedicareBob, founder of Senior Healthcare Direct. And in this video, I'm going to talk about the Medicare changes to Part A and Part B from 2022 to 2023. There are some decreases on Medicare Part B, but let's start with Medicare Part A. The Part A deductible is the amount of money that one has to pay whenever they go to the hospital before Medicare will step in and pay anything. This is not an annual deductible. This is per occurrence. So every time you go to the hospital, if you only have Medicare, you have to pay the Part A deductible. The Part A deductible in 2022 is currently $1,556. Starting in 2023, that is going to increase to $1,600. Now that Part A deductible covers you for the first 60 days. However, starting day 61, you have to pay a copay per day if you only have Medicare. The copay for 2022 is currently $389 per day. Starting in 2023, that is increasing to $400 per day. Also covered in Medicare Part A is skilled nursing facility or rehab. So if you go to the hospital and you're admitted for 3 days, you may not be healthy enough to go home, but not sick enough to stay in the hospital, or you might have to have rehab. They will transport you to a rehab or skilled nursing facility care. Medicare Part A will cover you for the first 20 days. However, starting day 21, you have a copay, an amount of money you have to pay per day. Currently in 2022, that copay is $194.50. However, starting in 2023, that copay is going to increase to $200 per day. So those are the changes from 2022 to 2023 for Part A. Now let's talk about the changes for 2023 for Medicare Part B. There are some good changes for Medicare Part B. The Part B premium, which is the amount of money that you pay each month for Medicare, the standard premium for 2022 is currently $170.10 per month. However, starting in 2023, that is actually going to go down. It's going to decrease. It's going to go down to $164.90 per month. Not a huge decrease, but hey, better than an increase. So again, if you're paying the standardized premium for Medicare Part B, your premium is going to go from $170.10 to $164.90 starting in 2023. Now, if you qualify for IRMA, which means that you make a certain amount above the threshold, then you might have to pay more for Medicare. Or if you qualify for LIS, low income subsidy, you might be paying less. But their standard premium is going down in 2023. Another decrease for 2023 is the Medicare Part B deductible. The Medicare Part B deductible is currently in 2022 $233. That deductible is decreasing in 2023 to $226. Again, not a huge decrease, but better than an increase. And then once you meet that deductible for the year, Medicare is still going to step in and pay 80%, and if you only have Medicare, you have to pay the remaining 20%. Now, as always with Medicare, there's no HMO or PPO. So you can go to any doctor or any hospital in the country that accepts Medicare. However, Medicare alone is often not enough. So I encourage you to look into a Medicare supplement, which is also called Medigap plan, or look in your Medicare Advantage plan options as well. But remember, if you go from a Medicare supplement to a Medicare Advantage and you ever want to go back to a supplement plan, unless you have a special circumstance, you have to medically qualify. If you'd like to learn more about your Medicare options in 2023, please reach out to my office and we'll be happy to help you. The phone number is listed below.